to be reviewing week 2 of visceral diagnosis and just doing a quick review of the skin, the hair, and the nails. We're going to start out with palpation of the skin, and what you're evaluating for is texture, moisture, temperature, turgor, and tinting. When looking for texture, we want to look to see the condition of the skin, how smooth, if there are any rough patches, as well as moisture, the amount, color, odor, and consistency. It's also important to kind of note location on that one as well. With temperature, you should always use the back of your hand, and this should be done bilateral and symmetrical across the body. You should always check several locations, and if there are areas of heat, it can be an indicator of infection, or if it's cold, it could be an indicator of lack of blood flow. With checking for turgor, that can vary by age, and you're just checking the elasticity of the skin. And with tenting, this is just grabbing the skin and doing a gentle pinch and lifting it. If the skin does not return back to normal within 1 to 2 seconds, it can be an indicator of dehydration. Next, we're going to go into malignant changes, and these can be sores that do not heal or persistent lumps and swelling. The characteristics of these can be shades of brown or black, and they can occur with rings in red, white, or blue. Other areas of concern could be development of a nodule, especially if there's erosion or ulceration on this nodule. An important factor to note is if there's any bleeding or discharge, changes of color, size, and thickness, and loss of skin markings. When looking for malignant melanoma, this type of skin cancer that develops from melanocytes, these cancer cells can migrate throughout the body, and they migrate early on, so it's important to detect it from the beginning. They occur about less than half that develop from nevi, and the exact cause of this is actually unknown. Factors that can contribute to it are hormonal, hereditary, ultraviolet light exposure, and autoimmune defect. So again, this is important to recognize in the early stages. If there is a mole that doubles or triples in a short time, such as 6 months, this is really suspicious and you should refer out immediately. If there is a spot, it should be cut out and then biopsied because it can spread throughout the bloodstream, so you don't want to biopsy first because this will guarantee spread. Malignant melanoma can kill a person in a matter of months, and they occur mostly from moles, and this is the 3rd most common type of skin cancer and is the top 5 killer in humans. Next is basal cell carcinoma, and this is the most commonly occurring skin cancer. Risk factors include those that are fair skin or people who are out in the sun a lot. They can occur in various forms, including nodular, pigmented, cystic, sclerosing, or superficial. They have their own blood supply called neovascularization, and they commonly occur in areas exposed to the sun, such as the nose, ears, and hands. Prognosis is very good with this cancer because it's very slow growing. An example given in class is rodent ulcer. And next is squamous cell carcinoma, and this malignant tumor arises in the epithelium. It is also very common in sun-exposed areas such as the scalp, back of hands, lower lip, face, ears, and top of the foot. It is characterized by having soft, mobile, elevated mass lesions, and it has the ability of going into the circular system and becoming systemic, or metastasizing, and going to other areas of the body. It is flattened and scaly-like and has the capacity to grow very quickly within months. This is the 2nd most common occurring type of skin cancer. And just to review, signs of malignancy are changes in the actual mole and its shape and color, and pigmentation if it becomes irregular in shape, and if it is shiny looking. Next is squamous cell carcinoma, and this creates a cauliflower type mass, and it spreads via the lymph and not by the blood. And next is Kaposi carcinoma, and this comes up commonly with people who have AIDS or a type of autoimmune deficiency. This can go into remission, but usually reemerges later, and is most commonly seen in Mediterranean populations. So just as a review, you're going to inspect the entire body for color, moisture, temperature, turgor, and mobility and lesions. And skin lesions are described according to characteristics, exudates, patterns of arrangement, location, and distribution. Next, we're going to go on to hair, and with this you want to review the patient's history, look for problems, patterns with growth or loss of hair, as well as changes in textures, looking for extremely oily or extremely dry hair, distribution, and scalp condition. It's also important to note the patient's health care, if they're using shampoo or not, if they have changed brands, if they're using medicated shampoo, if they're doing any treatment, or if they have any hair dye. With inspection, you want to inspect for color, distribution, and quantity. Note for any hair loss. Asymmetric hair loss may indicate a pathologic condition, and look for infestations such as lice or other parasites. And next, on to nails. Again, you want to note the patient's history. If they've had any changes or indications of breakage, splitting, thickening, swelling, drainage, or pain. You want to inspect the nails for color, length, configuration, symmetry, and cleanliness. And pigment deposits on the nail bed are present in dark populations, and this is common. However, if you have a light skin tone and have pigment deposits, this can be an indicator of melanin. Normal abnormalities extend into colors such as a yellow nail bed. This can be an indicator of psoriasis, fungal infections, or chronic respiratory diseases. Another one is spooning of the nails, and this can be due to an iron deficiency and an absorption issue in the gut. It can also be a sign of syphilis, fungal dermatosis, and hypothyroidism. This is most commonly seen in females due to the higher requirement of iron. Next is splinter hemorrhage, which is associated with subacute bacterial carditis. This is a concern with dental work, as bacteria from the mouth can enter into the bloodstream while dental work is being done. It's important to know patient history with heart issues or recent surgeries, as this bacteria can travel through the bloodstream and cause inflammation in the heart. And finally, ingrown nails. This can be hereditary or from ill-fitting shoes, and it usually involves the big toe. The nail grows into the dermis, causing pain and swelling at the lateral nail fold. And this concludes the inspection of the skin, hair, and nails, and there are pictures in Mosby's Chapter 7. Happy studying!